Another video. It's Thursday, 20th of April, 1 o'clock in the morning. I'm having chemotherapy. It's the first time to have chemo for a month. For various reasons, I've been too sick to have it and that kind of thing. I never thought I'd be glad to have chemotherapy, but I'm very relieved to be having it again. I feel very uneasy not having it because it's may not be helping me live any longer, but it's probably helping keep my condition under control and preventing the symptoms kicking in. I'm having immunotherapy next week. The type of immunotherapy I have, it's important to have it with chemotherapy if at all possible, ideally in the middle of 2 chemotherapy sessions. So the chemotherapy lasts for 3 days and should be every 2 weeks. So I can have immunotherapy in the middle of that. That's kind of the ideal time because chemotherapy damages your immune system. So you want the immunotherapy a few days after chemotherapy, so your immune system has had a chance to recover, and you don't want it too soon before the next chemotherapy because the chemo will sort of wipe out the benefit of the immunotherapy. So, but talking to the immunotherapist a couple of days ago, he said it may be worth trying to have an intensive course of immunotherapy. So have it sort of 6 times or something over the space of a couple of weeks. And that would be both types of immunotherapy that I have. NK cell immunotherapy, where the immunotherapist takes some of your blood, filters out the white blood cells, that chooses the appropriate type, puts them through a 2-week period of expansion, which basically I think kind of clones the cells or something, kind of makes them rapidly reproduce and makes them very active as well. So they have a better chance of attacking the cancer. And then the other type of immunotherapy I have is called dendritic cell vaccine. So it's another type of immune cell which sort of helps train your immune system to attack the cancer. So I think I'm going to try for that, although it's going to be a serious chunk of money. It's going to be like another £20,000, whatever that is, $27,000 or something, of which I only have about half of that available at the moment. So I'm going to be doing some fundraising and begging for money. Other than that, as I mentioned probably in a previous video, I've been unable to walk because the chemotherapy has made my body very weak to infections, and my foot got infected, and it seems the infection has maybe caused some nerve damage, or maybe a kind of a swelling of the infection has pushed against one of the nerves that goes through the tarsal tunnel, I think it is. The sort of the nerves that go from like your heel into your toes. So walking has been pretty much impossible, and I've been in the house almost all the time. I've invested in a pair of sandals, which has allowed me to go out a bit because not having shoes that sort of put pressure on the top part of the foot where the infection is. Had antibiotics that didn't work. I had a steroid ointment which I had to stop taking because it was too painful and damaging the skin too much, and the skin has now formed an ulcer. But I've now got a different antibiotic ointment to put on the ulcer, and I'm taking oral oral steroids, so kind of tablets that are very strong steroids that will hopefully reduce the inflammation. So I have been out a few times over the past few days. Had to go to hospital on Monday to see the doctor about my foot. I do apologise for not looking at you. The camera is at the top of the monitor, and not an easy place to look. And I went to hospital on Tuesday for chemotherapy. So that's my news, really. I am trying to come to grips with the idea that I'm really not going to live much longer, and I really need to do I really want to and should do something worthwhile with my remaining time. And what I really like to do is help kids who have terminal cancer. Fortunately, I think there aren't many, but I believe that they are not getting the help that they need at the moment. Well, I don't believe I know for a fact, because I see the cases in the news, because fortunately they are quite rare. So often media attention, and I think they should be having the kind of extra treatments that I'm having, the hypothermia therapy and the NK cell immunotherapy and the dendritic cell vaccinations, because two reasons. One is that both of these therapies seem to have a synergistic effect with other cancer treatment, like chemotherapy, radiation therapy, and even after surgery. After surgery is surgery really suppresses your immune system a lot, obviously. So it's really important to have some of the treatment to help that. And then the other reason, which may sound kind of ridiculous, is that they're not dramatic treatments, in that for most patients they're only going to make a small bit of difference. Although that small bit of difference might be very significant to the patient, right? A few extra months to live. But they are side effect free. Really side effect free. My immunotherapist had treated something like 10,000 patients, and he has had a handful of cases with minor side effects. Never had serious side effects for 10,000 people. The minor side effects are basically an allergic reaction. It's very, very, very rare with this type of immunotherapy, because it uses your own blood. So your body is not going to sort of reject anything. So especially for young kids, if you can give them treatment that might help a bit and has kind of no side effects, I think that's like a different way of looking at cancer treatment. When you hear about the kids with terminal cancer, they're trying like the newest possible therapy that may have a dramatic effect, but often has quite bad side effects, like a lot of immunotherapies do. The checkpoint inhibitors that I'm hoping to have if I possibly live long enough, at the moment the side effects are pretty major: kidney failure and serious stuff. So I think a different way of looking at cancer treatment for very for people who are very, very vulnerable to side effects, to having the serious impact of side effects. To me, it just makes obvious sense. Treatments that may only have a small effect but are going to have very little side effects, are definitely the way to go for kids with terminal cancer. So I'm thinking at the moment of what a good way to get involved in that would be. Immunotherapy is sort of, I mean, it's been around for 30 years, right? Invented by, modern immunotherapy reinvented by Dr. Rosenberg in the US, and the type of immunotherapy I'm having is sort of pioneered in Japan, although I believe it was maybe Dr. Rosenberg's team that invented it. It's been sort of approved in Japan. So, been around for like 20 years. Although you see in the media all the time immunotherapy in general being described as a new treatment. There might be talk about specific immunotherapies that are new, but in general it's been around for 20 years. But it's still very much poorly understood by everyone. But I mean, even by experienced oncologists. It's just the kind of thing that if you didn't come into contact with it, you wouldn't really know much about it. And for various technical reasons, it's very hard to do robust clinical trials for it. Just to give one very simple example of why, some immunotherapies, when the patient has them, they don't seem to have any effect in the short term. The patient gets disease progression, like the disease starts to spread or whatever. And in a clinical trial, those people would typically be removed from the clinical trial because often one of the things you're looking for in a trial is called disease-free progression. It's like, can they live longer without their disease progressing? So at this point, they leave the trial, stop being monitored, stop having whatever CT scans, blood tests, whatever they have in this part of that trial. And yet many immunotherapists will say they've had patients who have had some disease progression and then have lived a surprisingly long time. So those are the people are kind of falling out of the clinical trial. So really many different ways of thinking about clinical trials for people having immunotherapy. And particularly the types of immunotherapy I'm having are kind of, they're unusual in terms of cancer treatment because they seem to be cancer agnostic. They're not, or in a very, very limited sense of, they seem to work a little bit for cancers in any part of the body. Usually when you hear that about a treatment, that's a clear indication that it's bullshit. When someone talks about a wonder drug or whatever, no, not at all. This is the cure for cancer. Well, no, it's not, because the doctor may think of cancer as being maybe a couple of hundred types of disease. An oncologist might think it's about 600 types. An immunotherapist will tell you that it's tens of thousands of types. It's really depends on the genetic makeup of the cancer, and that changes over time, and the epigenome as well, and probably the human biome as well. So it's the kind of the bacterial environment, especially in the digestive system. But NK cell therapy, dendritic cell therapy, hyperthermia therapy seem to work for all cancers to a very, very, very limited extent. Thanks for listening. More videos soon, and I'll try and find a way of doing these videos where I actually can look into the camera. This is ridiculous. Okay, take care.